I don't always want to.
Chris, should we get started?
Yes, there's a couple more stragglers, but I think it's past 12:15.
Yeah. For the sake of time.
I like.
Okay, can folks on Zoom hear? I'll look for a thumbs up on the screen.
I'm just gonna.
Yeah, thank you. Okay, folks are trickling in here, but we'll get started. Really excited to introduce these great speakers who we're really lucky to have. Both Meghnath, who's here for a year, so that's lucky, but Mandira, who's here for 10 days, leaving tomorrow, so we're especially lucky to have.
It is.
Exactly. So really excited. I'm gonna stop talking and read their bios so you can see how incredibly prolific they are. So first, I'll start with Dr. Meghnath Dhimal, who is an environmental health scientist with over 20 years of experience across Nepal, the Maldives, Timor-Leste, Sri Lanka, Germany, and the US. His work centers health policy and systems research, burden of disease, global health, and planetary health, with a strong emphasis on environmental health and equity. He's currently Chief Research Officer at the Nepal Health Research Council, NHRC, and an associate academician in the Nepal Academy of Science and Technology. Internationally, he's a fellow of the International Science Council and a member of the World Health Organization's Strategic Technical Advisory Group on the prevention and control of non-communicable diseases. He also serves as visiting faculty of environmental health at Tribhuvan University, course director of climate and health in South Asia at the Yale School of Public Health, and is a Fulbright visiting scholar for postdoctoral research in the Department of Nutrition at the Harvard T.H. Chan School of Public Health. As principal investigator, Dr. Dhimal has led numerous projects on environmental health, climate change, non-communicable diseases, neglected tropical diseases, burden of diseases generally, and health systems in Nepal, and he has played a key role in formulating national and international policies and strategic plans in health, population, and environment. His contributions have been recognized through major awards, including the NAST Young Scientist Award, New Voices in Global Health Program winner at the World Health Summit, NHRC Outstanding Health Research Award, and the National Science, Technology, and Innovation Award in the health sector. Dr. Dhimal has authored over 300 technical reports and peer-reviewed articles, I think nearing 400, from what I understand, yes, and has extensive collaboration experience with UN agencies and leading global organizations. He holds a PhD in geosciences, environmental health sciences in particular, from Goethe University in Frankfurt, and a master's in environmental sciences from Tribhuvan University. That's Meghnath, and before and so the flow for context is Meghnath will start, lead us through our presentation, and then when we get to the Planetary Health Research Center, we'll have Mandira come in, so I'll read Mandira's bio now. Dr. Mandira Lamichane Dhimal is the research director at the Planetary Health Research Center in Nepal and a medical sociologist with over 15 years of experience in climate change, gender, migration, and health. She holds a PhD in social science from Goethe University, Frankfurt, where her doctoral research examined the gender dimensions of climate change and health, including climate-induced migration. Dr. Dhimal has led and contributed to numerous national and international research projects, including climate health studies funded by the British Academy, Harvard University, and the Red Cross, and has served as an associate research fellow at the Policy Research Institute, a think tank of the Nepal government, for 3 years before she joined the PHRC as research director. She's published widely on climate-resilient health systems, infectious diseases, social determinants of health, and NCDs, and is recognized for her expertise in mixed methods research, policy translation, and capacity building in planetary health. So incredibly prolific, both of them, and also just incredibly kind and wonderfully intentional collaborators and folks. So please, I'll let you take it away.
Good afternoon. Thank you so much for this invitation, and many thanks to my colleague Christopher for these special invitations. And it's my pleasure to talk about the global environmental science, nutrition, and health, linking with the planetary health approach. Because everybody talk the disciplinary talk like nutrition, health, environment, but there are very little nexus. So my aim today is not to give a detailed or hard science finding, but just to develop the linkage with the allied sciences, and how should we proceed in the future. So as a disclaimer, the views expressed in this presentation are of my personal and do not represent my institutional affiliated. So in today's presentation, I'll talk why global environment change matters. So global environment change doesn't mean only the climate change. Everybody is focusing to only climate change, but indeed not. Like air pollution, biodiversity loss, land use change, water resource, so many things are there, but people are focusing only to climate change. So my focus will be that way we should go beyond climate change. And next, why Nepal should be concerned about this issue? Because then I'll talk why Nepal could be an ideal country for studying this impact of global environment change. Though its emission is very, very small, like less than 0.027%. But in terms of vulnerability, it comes usually within the top 10 countries, right? Normally 4 or 5. Then I'll talk linking with the disease burden over the last 10 years or 20 years, how the disease burden has changed. For example, in nutrition, usually we talk about the malnutrition, but now 1/4 people have obesity, right? And another like 45% have the undernutrition. Now, how to make a balance, right? And then I talk about the policy response to address these impacts on, and what are the policy gaps? Because we formulated the policies, but there are some silos. And what are those silos that I'll talk? And finally, myself and my colleague will link why we need a concept of planetary health, especially in the global south. Because now we have a Planet Health Alliance, there are more than 500 university research institutes have joined, but there is a very little participation of global south, right? But if you see the impact, if you see start from the emission, means almost 80% emission come from the global north and development, right? But in terms of impact, more than 90% impact are in the global south, especially low and middle income countries. And if you see the evidence, means most of the evidence again come from the global north, and absence of the evidence should not be the excuse for the policy adjustments, right? So that means we all are living in a divided world. I mean, there is an increasing ethical crisis, I'll say, growing ethical crisis, right? So how to bridge that? Means the option is only the global south polarism and equitable sharing of benefit. So this aspect I also try to link. So why global environmental change matter? Because we all are living in a planetary boundaries, and many planetary boundaries have already broken, right? Out of 9, already like 6 have broken or exceeded, right? And normally we talk the triple planetary crisis. So triple planetary crisis means climate change, biodiversity loss, pollutions. And there are more, but I'll focus only these 3 because these are the major global pictures and they are interconnected. For example, the climate change caused the forest fire, and forest fire increase the pollution levels, and all have the impact on the human health. And there are also integrated relationship like impact of this climate change, pollution, also on the crop failure, and crop failure also have the impact on the health of the people, right? But usually we see in a single dimension, oh, there is a food reductions. But what are the underlying factors? We don't see usually, right? And what we do means we focus to the low-hanging fruits, like distributing the foods to the people and making the people more dependent, right? And finally, these are not sustainable plans, right? And second, I'll talk global environment is the threat multiplier for the equity, development, and well-being. We need to think from the equity lens. We need to think from the inclusion principle, right? But normally our policy and plan are bit blind, right? And I'll link the Nepal case studies, like what is the current situation and what are this policy and where is the gap? And finally, I'll introduce the concept why we need to think or mainstreaming the planetary health approach in addressing these global environmental changes. not only climate change. So there is also confusion between like One Health, planetary health, eco health, right? But they are overlapping concepts, I would say. But in a nutshell, planetary health is a very broad concept, which goes beyond One Health. For example, One Health concept introduced for addressing the zoonotic diseases, more focusing to the infectious disease, and still now for addressing to antimicrobial resistance and others, right? And we talk climate and health, again focusing to the quite narrow field, right? But when we talk the planetary health means it starts from the human caused biophysical changes, and especially how this affect to our life supporting system, like for atmosphere, right? Or the lithosphere, like the soil structure, land use change, or to the hydrosphere, like the water quality, water pollution, and other things, and also the life biome, right? And then we deal about the land use and land cover change. For example, dengue fever. It is like more endemic to the urban area. So when urbanization grows, means the dengue cases also grow, right? And it linked with the NDVI, right, or the vegetation index, right? And similarly, change in the biochemical force, like the nitrogen cycle, phosphorus cycle, and others, that also have the impact, right? Of course, climate change and resource scarcity, like the freshwater or irrigable lands, that has also impact on the migration of the people. Pollutions like air, water, soil, and also like the microplastic, that is also emerging field, and also biodiversity loss that are also in relationship with the climate change and others, marine degradation, and all these have the impact on the mental health, nutrition, non-communicable disease, infectious disease, displacement, conflict, trauma, right? And we need to see this overall picture to address in a holistic way. Otherwise, we'll just be in a very small portions, and that is not enough. For example, if you just talk the nutrition, linking the human health, right? Means we are just talking only the low-hanging fruits. Because we need to go to the cause or underlying factors, means how like the erratic rainfall affect to the productivity of the food, how the air pollution is affecting to the micronutrient level, right? Then only we can, address this problem in a holistic way. So, for example, how to understand the impact of anthropogenic climate change on human health? We simply talk about the direct impact, but there are also the indirect impact. To better understand it, we need to understand the driving factors like the societal values, consumptions, right? Demographic shift, technology, and innovation, right? Then we can talk about the ecological drivers like the global pollutions, climate change, biophysical and ocean change, resource scarcity, land use and land cover change, biodiversity loss, and all these also have the proximate causes like air quality, water quality, migration, displacement, so many things. And if we just focus here, means we are talking only about the causes, right? But these causes are influenced by the modifying factors. Mean our socio-cultural factor or likely, let's say, structural factors like social value, governance, health systems. Let me give one example of dengue fever. If the one dengue case is introduced here, it will be the timely diagnosis and there will be the secondary cases. It is linked with the diagnostic service and public health system, right? And no further cases, no outbreak. But in low and middle income countries, especially in the area where there is a high poverty, there will be the number of secondary cases, then only the health system will know. Then the problem is that it is very difficult to contain that outbreak. So this is also linked with the socio-economic status of the country, right? So we need to talk about this modifying factor, and these modifying factors are mainly linked with the adaptations or adaptive capacity. So if a country has the high adaptive capacity, even there are the impact of the global environment, there is less. And within the country, let's say within the United States also, there are the impact of global environment. Let's say pollution, climate change. But the poorest of the poor people affected must, because they don't have alternatives. Right? And finally, the health effects. And health effects depend on these underlying drivers as well as modifying factors. Just to take another example from climate change, each year extreme weather events kill tens of thousands of people. malaria alone kills 400,000 people. Diarrhea kills almost 600,000 children. And undernutrition kills 3.1 million children. And they are also interconnected. Like those who are undernourished, they have a high chance of the infection from, let's say, malaria or the dengue, right? And all are highly sensitive to climate change. And WHO estimate that by between 2030 and 2050, there will be approximately 250,000 additional deaths per year. And most of these data occur, especially in the elderly people, and like 48,000 due to diarrhea, 60,000 due to malaria, 95,000 due to child nutrition, and many others, right? And where does this death occur? Again, all death occur, especially in the low-income countries, where there is a less adaptive capacity. So, to summarize, the implication of climate change, you usually talk about the means and extremes are changing, and we focus to means. But for the health people, extremes are the more important because extremes are the ones which kills us. For example, floods or the landslide or the hurricanes, right? And usually the losses and damage are very broad, starting from the damage of the health facilities, settlement of the people, road. So that will affect to the access of the people to the health facilities. Though the event doesn't impact directly the people, but through the health system also it will be. And usually we talk about the infectious disease, but there are both physical and mental health will be impacted. So now the people are talking about the eco-anxiety, especially among the young generation, right? And this will accelerate equity and justice for the injustice. I mean, it will affect to the existing inequity and further aggravate the problems, right? Means poorest of the poor will be affected further, and more people will get poor. That's what we need to do means we need a climate resilient development, which means system building. Only from the vertical program we cannot solve this problem. It means we need to understand this nexus, and we should address in a holistic manner. That's why we need to maintain the planetary health, which is essential for the human and societal health, and protection for a climate resilient development. And in the past, many people talk climate change in it's the issue of climate scientists. And the other sector will almost neglect it, right? And in this 2013, this Nature Climate Change published article, Contribution of Anthropology to the Study of Climate Change, then more and more people, especially from social science, came in this field, studied, and now at least gender mainstreaming and other aspect is highly recognized in the climate change negotiation during the Conference of Parties. And more evidence are coming how this climate change affect to the structural vulnerability. And next, equally important issue is the air pollution. Every year, 7 million people die because of the air pollution. And like almost 4.2 million because of ambient air pollution, 3.8 million by the household air pollution. Again, most of these deaths occur in the low and middle income country. And globally, 99% people breathe unsafe air is for the WHO standard. Like only 1% people are taking the safe air. And this air pollution is not affecting to only health, also it is affecting to the agriculture system, agriculture productivity, and eventually our health is being affected. And globally, 1/4 means almost 24% disease are attributed by environmental factors, which is almost 30 million. So why Nepal is vulnerable to the global environment change? Whether it's the biodiversity loss, or the air pollution, or the climate change, or the change in the water quality and quantity. Because of its complex topography, like it has the lowland, like less than 100 meters to the mountains, right? And a small change in the temperature or the rainfall affect drastically to the microclimate, right? For example, in the mountain, we have a risk of the glacial lake outburst flood. And in the hill, we have a risk of the landslides, right? And in the lowland, we have a high risk of the flooding, right? Means different topography have the different types of exposure. And in terms of sensitivity, we are dependent on the climate sensitive sector like the agriculture, and it's a rain-fed agriculture systems. So if there is not a timely rainfall, means it is it completely affected the agriculture system, like the plantation of rice and everything, right? And high dependence on the climate sensitive livelihoods like the rainforest agriculture, forestry, hydropower, etc. And we have very limited adaptive capacity because of the high poverty level, infrastructure gap, and fragile health system, means weak public health system. And there are also the social inequality, like the caste system, ethnicity, gender, topography. It's a very small country. We have 125 ethnic groups. 125 languages are spoken all over the country. And that means this caste system and marginalized group are at the high risk because usually they don't have the access to the early warning system and others. So Nepal's vulnerability to global emergence can be compounded by the two, means biophysical vulnerabilities as well as socio-economic and structural vulnerability. For example, in 2024, there was a extreme rainfall in Kathmandu and around, and it was one of the worst flood in last 50 years, and almost 70% of this, flooding was caused by the climate-induced because of anthropogenic activities, and which just took the life of more than 240 people within like 24 hours, right? So it's a stark example of Nepal's emerging new normals. And then every year now we have a flooding. But in the past there was no flooding. And the flood come in the post-monsoon season, right? Normally it should be a very normal time. Means pattern of this extreme event hasn't changed a lot over the years. And similarly for the infected disease, like Nepal was dengue-free country till 2004. We had the first case in 2004. In 2006, we had the first outbreak with the 32 cases from 9 districts, border with the India. But now we have almost all districts are affected, even the hill, mountain are affected with the dengue fever. And more than 50,000 cases each year, more than 100 deaths, means this is now endemic. And it is linked with the warming in the hill and mountain, because warming rate is much more higher in the highlands of Nepal. So we need to look from the planetary lens to address these extremes, because climatic extremes are the symptoms of broader planetary change, or climate, land, and water means planetary boundaries. And nutrition and health impact are produced through the food systems, waste, and social structures. So we need an effective response which must link the climate and land management. Similarly, agriculture, social production, and health service should be integrated. Like we must introduce the insurance program for the agriculture sector also. We must have the climate smart agriculture system to address the emerging risks from the climate change or the pollutions. And at the same time, we must have the equity focused planning, addressing the need of the different ethnic group peoples, gender, and geography. Because the plan we made, the blanket plan we made for a whole nation may not be equally valid for the lowland, mid-hill, and highlands. So finally, planetary health helps connect these sectors and skills from global drivers to local health equity in Nepal. So how does climate change affect the food security and nutrition? We all know, right? Because there is a clear established fact, right? But there is a disproportionate burden on the smallholders, land poor, and the remote communities. So we need to focus to those people who are worst affected by the climate change, not only the blanket areas. That's the message. Because the climate change will change the nutrition intake of the foods. For example, that will increase the carbohydrate level, reduce the micronutrients and certain things. So that will affect to the anemia, iron deficiency, and others, right? So we need to understand it in the context of different ecological beds. Then accordingly, we need to make a plan rather than like blanket approach iron tablet distributions. So impact of environmental change can be seen in terms of increased mortality and morbidity, economic and social costs, food security and nutrition livelihoods, health equity and vulnerability, and finally, very important and often missing is the psychological impacts. For example, many farmers in India attempt suicide because of the long drought. The reason is that they cannot pay the debt, so they attempt the suicide. Similarly, there are some publications from Australia, similar pattern. And in the future, the risks of the suicide might go high, especially among the farmers, because of this erratic rainfall, long drought, and others. Let me give you one example of anemia in Nepal. Anemia is a common health problem in Nepal, particularly among the women and children. And according to the Nepal Demographic and Health Survey, the latest 2022, almost 44% children under the 5 years and 34% women is 15 to 49 suffer from anemia. And the prevalence of the low birth weight is also quite high, right? And the factor contribute to the high prevalence of anemia in Nepal are including poor nutrition, limited access to healthcare services, and high burden of infectious such as malaria, tuberculosis, dengue, etc. And iron deficiency is common cause of anemia, and many Nepalese diets are lacking in the iron resource. And this is also linked with the chronic disease like the sickle cell anemia. Certain group like the Tharo community have the high prevalence, almost 50-60%, right? But others do not have. Means we need to address their needs also when making a plan. And ultimately, climate change can aggravate the anemia in several ways, and that also need to be addressed in plan. So this shows the prevalence of trends of anemia using the Nepal Demographic Survey data. But important point that I want to highlight here is that we have like 7 provinces, 77 districts, right? From the equity lens, if you see, means overall, let's say it is a 34%, but in some provinces even more than 52%, right? Means there is a unequal distribution of this prevalence by the provinces, by ethnic group, by literacy level, and that need to be also addressed when making a plan. Same goes for the children. So maybe I have big time, so I'll just summarize here shortly. Like the impact, specific impact of this global environment change in the mountain case, hill and Tarai will be different. For example, in the mountain regions, if there is a persistent or long drought, means there will be the crop failure. And the option for the people is to migrate to the lowlands. So many mountain people are now, migrating towards the lowland because of the tourism. First, there is a scarcity of water. And second, they cannot produce the crop. As a result, they are compelled to migrate in the downstream, like the hill and lowland, right? So if it continue, means many ethnic groups will lose their life from the high mountain. So one example. And same way for the Tarai people, they are repeatedly exposing to the crop loss and also suffering from diarrheal disease and the malnutrition. Like the highest prevalence of the malnutrition is the Madhya Pradesh, which is also in the lowland Tarai. So that also need to be addressed, the broader impact from the global environment sense. And equally important is that drought-resistant crop improve the food security and nutrition. But as a policy maker, we should be conscious in a sense that we need a strong post-harvest management to prevent the fungal contamination. Example, aspergillus, which produces the aflatoxins. And aflatoxin exposure, which increases during the drought, is a major health threat, causing the liver cancer, including linked to the kidney disease through the oxidative stress and nephrotoxicity. And now in Nepal, 73% death is caused by the non-communicable disease. And that NCD and that microtoxin exposure also need to be addressed when making a plan, rather than the isolated plan for nutrition, isolated plan for the NCDs. So this was the change in disease burden in Nepal over the last 40 years. And still the air pollution and the malnutrition are the major cause of death in Nepal. And the NCD burden has drastically increased in the country. And what are the major causes? Still we need to explore. Like the pollution is definitely one cause, and malnutrition and others, and also smoking. And to address this problem, there are the several policy and plans to address the, let's say, health impact of climate change. Similarly, there are the several policy based on the research studies, right, on the climate change and health, right. The question is, again, and also on the agriculture sector, there are the several policy and plans right? And they also address the climate change aspect, also pollutions. Similarly, other Southeastern countries are working on this, right? But important point is that all these documents are not implemented in practice. Most of the focus of the donor as well as the government is formulating the policies. And they think that they completed their job. And all this will not even open sometime. So that's the major challenge, right? So the key gaps and challenge is that limited climate informed and equity sensitive health data and surveillance systems. Second, we have a limited evidence about the high prevalence of both undernutrition and obesity. We have a double burden of nutrition, I'll say. Right? One is the obesity and next is the undernutrition. So how to make a balance, that's a big challenge. And even the health facilities are vulnerable from the floods, landslide, and providing the continuity of care is very challenging, especially in the climate-induced disaster area. And we have also the weak link between the health, agriculture, water, urban planning, nutrition, and environment. These all sectors should be interconnected, right? And underrepresentation of remote and marginalized group in research and planning. So we need more co-production, co-design, and co-creation when conducting the research rather than top-down approach. And finally, we need to move from the small pilot to scale sustained adaptation and mitigation. And when doing all this aspect, the equity aspect should not be missing in policy and planning. So again, coming back, we need the planetary approach that I just highlighted earlier, starting from underlying drivers, environmental changes, proximate causes, modifying factors. Then only we can address the health impact. Otherwise, if we just focus to only the health impact, let's say talking about the mental health or the nutritional disease, we cannot achieve the sustainable management of this disease, right? And the cost might be very high if we forget these underlying drivers. So now I would like to request Mandira to continue why or how can we address such challenges in Nepal through the planetary health lens? Thank you.
Thank you, Meghnath, and good afternoon, everyone. Now I would very briefly give the overview of Planetary Health Center Nepal. In shortcut, it is known as PHRC Nepal, which is established in January 7, 2024 by the interdisciplinary group team who are dedicated to work on the planetary crisis. So PHRC office is very near to the Nagarjuna National Park. And so PHRC, we aim to PHRC aims to contribute for addressing the social determinants of health through the equity perspectives. It aims to bridge the evidence, policy, and practice professional through the interdisciplinary research, breaking the silos of disciplinary. And it aims to provide the interdisciplinary planetary health perspectives to address the interconnected of the planetary crisis, such as air pollution, biodiversity loss, climate change. It also aims to strengthen the participatory research and the co-production to address the evidence-based decision making. We also aim to support the capacity building to the next generation who are interested to work on the planetary health. And importantly, we promote responsible conduct of the research for the equitable distribution of the benefits. So this is we also have the PHRC office. We also have the research training center for the planetary health research, and we promote greenery. This picture was taken just a week ago, and we also promote for the nutritious organic food. And at PHRC there is an exchange program, and the students from the different universities, they visit us and they learn from our work. And at PHRC we are very closely working with the government of Nepal, especially with the Ministry of Health, Ministry of Environment. We are also closely working with the different universities of Nepal and abroad. We are also closely working with the civil society and the international partners. So at PHRC, we are just 2 years old, and we are closely, our research collaborators are the Harvard School of Public Health, Harvard School of Medicine. We are very closely working with the University of Oslo, Norwegian Institute of Public Health, our federal, our provincial government of Nepal. And at PHRC, we aims to generate the local evidence on climate, environment, and the health risks. We also support policy and implementation, for example, vulnerability assessment guidelines, developing the prediction model. For this, we are, for the disease prediction model, we are closely working with the University of Oslo, using the DHIS2 application, and we also aims to build the capacity of the students and practitioners in the planetary health. So because of the time limit, I just went quickly, but if you have any, if you want to know more about the Planetary Health Research Center, or you can visit our website, or you can email us. So from the Meghnath and my presentation, the take-home message is Nepal is highly vulnerable to the global environmental change with clear impact on nutrition and health. Our second take-home message is risks are unequally distributed, so marginalized community carry the heaviest burden, like the impacts are not equal. So, and our third take-home message is existing practices are important but not sufficient. So, implementation and the equity must be strengthened. Next take-home message is a planetary health approach is urgent to integrate climate, environment, nutrition, and health across the sectors. Our another take-home message is Planetary Health Research Center and the partners can help to strengthen evidence, policy and practice through the interdisciplinary approaches. And our final take-home message is the invitation, like the collaborative research, policies, and the education to promote planetary health through the global South and North collaboration, global South-South collaboration. So thank you so much. Thank you so much for your attention. And I'm really happy to address if you have any questions, queries regarding our presentation. Thank you.
Awesome. I'll say thank you both. And while folks are thinking of questions, either in Zoom or in person, maybe I'll ask the first one. I don't know if you both want to stand in the front. So, we're the Freeman School of Nutrition Science and Policy, and I think you both sit exactly at that intersection point. How can you talk a little bit more? And you did mention some of the barriers, say, to train, you do all this amazing work and then a report sits somewhere unread. So can you talk about the different barriers and maybe even some successes, perhaps, of how the research translates to policy and action?
Thank you so much. Let me start by saying, so especially working in the cross-cutting issue is a bit challenging, the low and middle income country, and maybe similar here, but I don't have the experience. Like 15 years back, when I talk about the issue of the non-communicable disease, then people don't know it's not our problem. It's the problem of the rich people and rich country. Because problem of the low and middle income country is the infectious disease, like diarrheal disease or the TB or malaria, etc. Right? But we did a research and we came to the conclusion that as NCD is also increasing in Nepal, then we came up with the multi-sector NCD action plan. Multi-sector action plan for prevention and control of the NCDs, right? So formulating the policy also took a time, but now again in implementations, it needs the multi-sector collaboration, right? The agricultural sector, environmental sector, Ministry of Finance is very important, Ministry of Health. So bringing these all the people together, right? And implementing these activities is a really challenge from our experience. Same goes for the nutrition. Initially, we thought that nutrition is a problem of the agriculture sector because we need more production, we need the green revolution, etc. Then we can solve the problem. But later, we realized that Ministry of Health also equally important because first auditor should be the prevention of this problem. But if the problem comes, means we need also treatment, right? If we have a severe malnourished people, means we need to treatment, right? So what now we make a like multi-sectoral NCD, nutrition action plan, right? And then again we revise, we evaluate it, right? In this way, what we understand is that evidence has the power. If we have a concrete evidences and also linking with the economic instrument, economic evaluations, and then it is easy to convince to policymakers, especially for the resource allocation. And if you can insert the resource allocation, whether it's a domestic or the international, then such plan and policy will be translated into practice, right? And third important is that we should be the self-reliant, right? If we depend everything to the, let's say, donor, right? And if the donor just exit, means we cannot do, right? So for example, for health sector and the education sector in Nepal, over the year, we are reducing the reliance on the donor money. So once, because of the geopolitics, many donors exit from the country, also we don't have the really big problem like in other countries, right? But if you are dependent only on those donor money, it's a very critical problem, right? So, and that also depend on also the research. So what we realize that we need to increase the more investment on those research. That's why for doing the NCD risk factor survey or others, or even now we are planning the National Integrated Health Survey, focusing on micronutrient, this demographic health survey data. So in this way we can, share the more evidence, and that evidence, if we can convince to the policymaker in their language, then it is easy to translate into practice. But it really takes a time. We cannot change over the night, but at least if we continue to generate the more and more evidences, including the economic evaluation, it is easy. But usually gap is between the communication between policymaker and the researchers. Like I work in the both head, that's why I know. Usually what the researcher think, oh, I publish in the New England Journal of Medicine, I publish in the Lancet, and she thinks my business is over. But nobody will read this paper as a policymaker, right? And if you go and ask to the policymaker, they say, oh, no, we need to answer this question. But where is the evidence? I don't know. Nobody has come to meet me, right? Means, as a researcher, I think we should communicate with these policymakers, and our research should be the demand based. And if we can develop a plain language summary or let's say policy brief and give to them, that is more powerful to them rather than the paper of the Lancet or the New England Journal of Medicine.
Yeah, and that's why at the PHRC we are also starting developing the policy brief of this research. Yeah.
Thank you. Any questions in the room, maybe, or on Zoom?
Please.
Yeah, thank you. That was a wonderful presentation. I have a mate who also was from Nepal and he spoke with passion just like you. Yeah. My question is, when you were talking about the issues of climate change and heat-related deaths, about 38,000 citing the World Health Organization, that is alarming. But last week in our climate change class, we also had a talk about cold-related deaths. And in some reports, it is even higher than the heat-related deaths. So this is like close to the double burden of malnutrition. So how do we fit this into the climate change narrative?
Yeah, that's a very good question. And I was the only one 15 years back to fight the issue of the cold waves. The people usually talk climate change in the heat waves, right? But climatic variability is a big issue, like that, right? So cold waves is also induced by the climate change, right? So we should address the both cold wave and the heat waves. For example, the lowland Tarai of Nepal is badly affected by the heat wave in summer or the pre-monsoon, and also badly affected by the cold waves. Means our plants should be responsive for the both cold wave and heat waves. For example, let's say in Europe had the very good facility for warming, focusing to the winter. but they don't have, the old house don't have the cooling system, right? That's why when there was a heat wave in 2003 in even England, many people die, even in France, right? So means we need to be ready for the both, resilient, means for the cold as well as heat. And I'll say this, now WHO has already included this, cold wave is also linked with the climate change. So climate change doesn't mean that only warming. And that's why I told that not only means we have to focus into the extreme, because extreme are the one which kills us. So both heat waves and cold waves are important. Thank you.
You talked about how research is disproportionately, covers the global north. What are some of your favorite, essentially venues for publication that are different from the Lancet or the New England Journal of Medicine? What are that you feel people internationally should be reading?
That's a great question. So I think two things are very important here. One is the, yes, reputation of journal. Everybody is going behind the impact factor of the journal, right? So for me, important is the open access publications, right? If it is published in the open access journal, let's say just +1 or the PLOS Medicine or the BMC, Public Health, and etc., means it is easy to share also ethically also, right? I can share in the social media, I can share with the all policymakers, maybe 1% or 2% will read. But if I share the, let's say, link of the Lancet, and if it is not open access wall, means nobody will read, right? And second thing, as a non-native speaker of English, what my modality is that usually I collaborate with the colleague from the global north. Yes, first thing, definitely I give the technical input, maybe in design or at least in the language editing, right? And that is where means we can develop the next. So far now I published almost 400 papers, and I think only one paper is not only in the subscription-based journal. All papers are in the open access journal because of the two reasons. First, as a corresponding author and first author from the low-income country, I get open access facility. And second, if they charge money with the funding, means usually the global north, when they have money, they will pay, right? So if we can promote at least, yeah, there are also the loopholes of this open access publication, even like Nature Journal has $7,000-8,000, very difficult, right? But even in the low impact factor journal, if you can publish in open access journal, it's very good, especially for the policymaker of the low and middle income countries. So my strategy is to collaborate between global north and south. So I don't mind how many co-authors are there, because during my PhD, I wrote the first author publication. I did like 7 papers during my PhD. Then after, I don't matter first author for me. Maybe once a year I publish 1 paper. Otherwise, I just go to like 70, 80, even 1,400, 1,600 co-authors, like in the global burden of disease collaborations. And this paper get highly cited. People read, and also normally such projects are funded by the big planetary like the Bill and Melinda Gates foundations, and also open access, though they publish in the Lancet. Yeah.
Hope you're being quiet. I can ask you another question related to that your first point on the policy. Oh no. Okay, sorry, Elena. I'm gonna finish mine and then I'll. I remember the first time I heard this so convincingly to your point on the policymakers have to understand what we do in our little laptops. You in Kathmandu, and then you said we were talking about climate smart public health and all these okay, what method and what data set, and I remember you said, and you kept coming back to, okay, but how many deaths are we going to project, or what is the outcome? And that was normally when scientists say that, sometimes it feels, this is just my opinion now, that sometimes it's for a sensational kind of first abstract opening line in a high impact journal. But you kept drilling down to, I need to go to a policymaker and say, this is the impact. This is why heat matters. This is why air pollution and smog matters. And so I guess my question is, when you think about nutrition or food systems and the kind of work you do and the evidence you're generating around that, how are you capturing that? So still thinking of morbidity, mortality related to nutrition, whether it's anemia or stunting or wasting or deaths associated with nutrition, but then still capturing all the complex nuance that you're describing that planetary health requires. You have to get to the number, but also there is social systems, economic systems. How do you translate that and a policymaker listens?
Yeah, that's a very good question. So normally for the policymaker, usually, policymaker means major are from the Ministry of Finance, and they understand only the money. How much money we need to invest and how much will be the benefit. That's why for them, the important is that, like, let's say, how much mortality or morbidity we can avoid because of this intervention and how much it will be cost, right? So if you can link, then it is easy. So normally, nowadays, what I do means, rather than the other research, I focus to the implementation research, right? So I sit with them, I try to understand their research questions and then develop the tools. I do the co-production workshop, and I engage in every activity to them whatever is possible, right? As a result, what happened that I also give the co-authorship to them, right? And I think it's a global trend now. When everybody is talking about the implementation research, right? And the good news is that if we can enhance their capacity in the research or develop the motivation in the research, they will advocate for this later. That's why now many policymakers, even in the low-income country, are coming here in developed country for their PhD or the master degree. And it means it is easy, right? So, like you mentioned, it's sometimes very difficult to quantify this underlying factor in between, right? But if we can show in the form of like infographics, right? And if they get convinced, it will help to develop coordinations. If we don't explain this thing, then they say, okay, it is not my duty. For example, 20 years back, I started my government service, and I was first guys coming from the environmental science background. And when I talk about climate change effect to the health in the Ministry of Health, they said, no, don't talk this. Because it is not our responsibility, it is the responsibility of Ministry of Environment, climate change. And when I go to the Ministry of Environment and talk about this health issue, they say, no, we'll not take care. It's not our responsibility. So especially in the low and middle income country, working in the cross-cutting issue, like domestic violence or gender or climate and health or health, extremely difficult. So we need an expert who can bridge this thing and convince to the both sectors. Same goes for the nutrition. Otherwise, you say, oh, it's a Ministry of Agriculture, it's a Ministry of Health, it's a Ministry of Commerce and Supply, right? So we need to understand the language of this policymaker, and we need to work closely with them. And if we can explain the mechanism of this underlying factor and policy factors, then it is easy to convince. So in this way, I work especially in 7 countries like Timor-Leste, Maldives, Sri Lanka, Nepal, to develop the SNAP and also other documents, and quite convincing. And also it is easy to donor also, if you convince, means for funding to also.
You want to go on Zoom, Elena?
Yeah, I would love to go next. And I have 2 questions. One question, the first question is related to, maybe you can share your experience on talking with climate deniers. I live in a community which basically like preach the same motto. I rarely talk to people or have an opportunity to talk to people who are obviously climate denier or at least very skeptical. And especially about the numbers WHO or any organization produced related to sort of deaths related to climate change. So I'm just curious, what was your experience? Can you just give an examples of when you talk to those climate deniers? What is their arguments?
Thank you. It's a great question. I may have bad answer. So at least in my country, there is no climate denials. There is a high political commitment, right? So that is the good news. And it's coming off, and it's directly linked with the business. So whether we favor to the business and economy or also to the health of the future generation or others, that's the matter. Let me give another one example from Australia. Like Australia is also a developed country, but they had no climate and health policy strategy since till 2 years back. But what happened means all the students came in the street on Friday asking the climate sick leave. And finally government just surrendered, come up with the climate and health strategy, and now they are working. Because these children had the power, right? Several other events too, right? And same was to this country. I don't go in detail, right? It's coming, going, agreed, right? So it's linking with the business and economy. So definitely we will get sometime the 100% concurrence on the same issue. And for me personally also, though I work in the climate and health, sometimes, yes, I don't also like this because everybody talk everything to the climate, but should not be. So why does the same ministry people do not work together on the air pollution and climate together? There is a more death from the air pollution than the climate change, but everybody talking only climate change, especially in the global south also. But focus should be also on this air pollution issue, also on biodiversity issue, right? So I think we need a holistic and balanced decision making because we should continue our economy. At the same time, we should protect our planet. And in the name of protecting the planet, we should not be biased and talking only one dimensions. So globally, I'll say more people are focusing to only the single dimension, only talking climate, climate, climate. Like for example, they have the conference of party with a gathering of more than 80, 90,000 people per year. So see huge emission from this same meeting. So maybe can be done the like virtually, right? So I think we need to be also balanced and we need to correct also ourselves. And because of such activity, sometimes also, people become the very anti-climate. Yeah.
Yeah, well, that's exactly I'm interested in. When people talk about anti-climate, what is their argument? I'm really surprised that you never have an experience to talk to people who have a different and opposite point of view, especially when you talk about mental health and climate. That's very difficult to prove.
Exactly.
And very, very difficult to defend because of between the mental health manifestations and whatever climate conditions we have, there are so many other factors could sit in between. I'm just very much wondering, like, what is the logical flow and how you going about this type of a challenges?
Yeah, thank you. That's a great question. That's the same question the many policymakers ask to me. For example, if I talk, okay, climate change effect to, let's say, diarrheal disease, and they will ask me, what is the attribution of climate change? Because we cannot relate everything to the climate change. Right? That is linked with the behavior of the people, water, sanitation, hygiene, etc. Right? So, for example, there is a recent one paper from a colleague, Marisa and others, that historically 18% dengue fever is attributed by climate change. Right? This is the evidence, right? And with this, we can convince, okay, see, yes, climate change will not affect all cases of dengue, but let's say 18%. Similarly, we can come with the conclusion that, okay, for the mental health, the attribution of climate change or climate-induced disaster is, let's say, 7% or the 15%. Then it is easy to convince, right? Otherwise, as a scientist, if everything is linked with the climate change, means it is difficult to convince to the policymaker. I really agree on that. Thank you. So means we need a more robust evidence to attribute the contribution of the climate change or the air pollution rather than the aggregated picture. Okay, it is linked with the climate change. Yeah.
Okay, thank you very much.
Welcome.
All right, I know we're at time, so can you give them a thanks one more time? Thanks.